I want to thank the Answer Coalition and the church for taking the time to sponsor this very important event. And I have to say that this is a very difficult time for me to be able to speak about some of the health effects. And I think Richard's point in particular needs to be taken very, very seriously, because this is not, from a health perspective, just the 9-year anniversary of the invasion of Iraq. When we think about the health implications of war and occupation on the people of Iraq, we're talking about brutal, crushing sanctions that have and wars and occupations that have lasted 21 years and more. Not to mention the tons of depleted uranium that have been dropped on Iraq over the years. And just in terms of overall context, if you try to look at Iraq itself, before the sanctions, before the brutality started coming from the United States in terms of the occupation and the war, Iraq enjoyed perhaps the best healthcare system in the entire, if not the Middle East, the entire region. It was universally thought of as not having one of the best healthcare delivery systems, but it had universal healthcare. It had universal access. It had the best medical schools in the entire region, some of the best physicians in that entire region, who practice to this day, graduated from the medical college in Baghdad. And when we look at what has happened today to the people of Iraq, Richard actually alluded to this. When you have a quarter of the population either being killed, displaced, or wounded, imagine that for a minute. Imagine the physical, if not the psychological impact on this population after 21 years. In global health, we have general indices thinking about the impact of how a country or how a people are doing in terms of general health indicators. Morbidity, mortality, just the development of chronic health diseases. Generally speaking, most of the world, even in some of the least developed countries of the world that we know today, are either stable or on a general increase in terms of these general global health indicators. I'm very, very sad to say that the 3 parts of the world where these general health indicators are on a decline: Iraq, Afghanistan, Palestine. And it's, in some sense, to me, unimaginable to think that all of the general health indicators that we take for granted every day here in the United States, that we have regions of the world, because of our direct influence, where these indicators and indices are actually declining. For example, at least 50% of the population of Iraq today is living on less than $2 a day. Now, I would ask each and every one of you in this room to imagine for a moment what it would be like to live on less than $2 a day. If you buy a coffee, it's going to cost you more than $2 a day. But this is for everything. We're talking about everything: food, water, clothing, everything. In Iraq right now, in Baghdad, we don't even have electricity 24/7, 7 days a week. This is 9 days after the most recent invasion. We still don't have electricity on a regular daily basis. And if you just take the next level of analysis from that, what do you think? What do you need to run a hospital? What do you need to run a clinic? What do you need to access health care? Well, if electricity is not there, if the basic necessities of being able to provide health care are not available to you, like electricity, it's not a far stretch of the imagination to understand now what is happening to the people of Iraq. We know that cancer rates are on the increase, especially for children. We know that there still are not complete functioning hospitals anywhere outside of the international zone now. Of course, within the international zone, and this thing that is called the U.S. Embassy in Baghdad, which is, it's hard to call it an embassy, it's a city-state. It's 10,000 people with its own power generator, its own hospitals, its own police force. It's this massive undertaking. You can get good health care there. But once you go outside the international zone, once you go outside the US Embassy, health care for Iraqis, which did in fact enjoy a level of health care previous to this 21 years, better than many parts of the United States for that matter, are suffering horrifically. On a topic closer to me in my training, obviously, it has to do with the psychological impact. And I only have a few more minutes left, so I can't go into the kind of depth that I would like about Iraq. But to suffice it to say, after interviewing some of the people who were stuck in Abu Ghraib, and having interviewed a number of Iraqis who ended up coming to the United States and into Europe, I can tell you that the long-term psychological impact on the people of Iraq has been devastating. You know, it's easy to rebuild a building that has been destroyed by a bomb. But think about what it takes to rebuild someone psychologically whose country has been torn asunder. Think about what it's like for someone to rebuild their emotional status when they've had to witness their family be, essentially be murdered. When their thousands of years history is completely obliterated. When somebody who is sought to be a liberator, and we don't have the time to talk about all the atrocities. We're fixated on the atrocity that happened in Afghanistan last week when an American serviceman murdered 17 Afghans. But stories like that, in fact, repeated itself multiple times in Iraq, which did not get reported. The psychological impact is not something that can go away in weeks, months, years, or decades. In fact, some of the research that I've done suggests that it takes up to 4 generations to actually begin the process of finally healing from such a grotesque and perverse trauma of war and occupation. The war and occupation of Iraq has not stopped. And I think it's so important to get over the illusion that somehow, and by the way, no one in the Arab world believes that that occupation or war is over. Nobody in the Arab world or Middle East believes that we are even approximating anything close to democracy for anybody, plus or minus Tunisia right now, anybody else in the Arab world or Middle East. So let's be clear about it. Iraqis are not any freer now. Iraqis are not better off in terms of all of the health indices that we understand in terms of general health and wellness. And the psychological impact is devastating and could last for generations. Let me switch gears and talk a little bit about Palestine. Because of all the countries, of all the places that have been under the boot and the thumb of this imperial juggernaut in the Arab world in the Middle East, it's been Palestine. As Richard said, 64 years and counting. And we just published an article in the International Cancer Journal looking at childhood cancer rates for Palestinian children in the West Bank. And to our horrific surprise, I shouldn't say not too much sorry, but to our horror rather, we're seeing relatively dramatic increases in certain cancer rates for children in the West Bank. In fact, in this little village in the West Bank called Yatta is a dramatic increase in childhood lymphoma. So people are always saying, well, why? What's up with the children in Yatta village in the West Bank? Well, it just happens to be the closest Palestinian village to the Dimona nuclear reactor. And this is the first empirical evidence that we've been able to publish, in the scientific journals. The villagers, by the way, in Palestine, in these areas, have been telling us for years, there's something wrong with our children. There's something wrong, there's something wrong. Well, this is the first time that it's been empirically identified, and there is this dramatic increase in childhood lymphoma in this village. What you're also not hearing about in terms of the media right now is Gaza is one day away from a catastrophic and cataclysmic destruction of its healthcare infrastructure. Why? It's got 1 day of fuel left. Again, same process. When fuel runs out, everything shuts down. You know, people don't realize that within 24 hours of the invasion of the most recent invasion of Iraq, there was a catastrophic collapse of the healthcare system because there was no power and electricity. This was, in my opinion, deliberate. I'm talking about what is the effect of these wars and occupations from a psychological perspective is an attempt to get people to agree to be occupied. And if, in case you hadn't noticed, when your health is not well, it's hard to resist. In case you haven't noticed, right? When you're not feeling well, when you hear bombs over your head, you see your family being slaughtered, it's hard to muster up the energy, physically or psychologically, to resist. That is a prime component of what we saw in Iraq. It is a big component of what we see in terms of what happens on a day-to-day basis in Palestine. Gaza being one day away from not having any fuel whatsoever means that all of the hospitals will completely shut down. That means if you need dialysis, you're not going to get it. That means if you need chemotherapy, you're not going to get it. That means if you need to travel from point A to point B to receive your health care, it's not going to happen. So the consequences of wars and occupations, what we typically understand as the consequences, are much deeper, are much more complex, are much more difficult to overcome. Even when the so-called occupation stops, the effects can last, as I said, for years, decades, and generations. I'll just end by saying a little bit, my time is up, was up about 10 minutes ago, sorry. I kind of warned Richard, once you get me going, it's hard to stop. But let me just say, unfortunately, the situation in Afghanistan is no better. Afghanistan, Palestine, Iraq are one of the few places on the planet where people are getting sicker. And this is an unacceptable consequence of these brutal wars and occupations. Thank you very much.